Hello there, it's Dr. Hill here at Lone Star Plastic Surgery, reaching out to you. We're actually in the office today. Tuesdays and Thursdays are typically our clinic days. And I wanted to make a little video here because there's some questions that we get asked all the time. And one of the more common questions I get is during our breast augmentation and breast lift with implant consultations is how do we pick the perfect implant? If you want more information than's on this video, I do have a blog on our website, LoneStarPlasticSurgery.com. You can look that up there. It goes into far more depth than this video is going to do. But in reality, it comes down to a couple of basic steps. Number one, we want the implant that's going to be perfect for a patient's body type. If you go too big, then the implant may dwarf the patient. If you go too small, you may not get the cleavage that you're looking for or the fullness, the upper portion of the bra. Top or the bikini. And so typically that's the most important thing. So the first thing I do is I measure a patient's width of her chest from where the ribs attach to the sternum there to the anterior axillary line. That's called the breast base diameter. Okay. After I do that, we then match the base diameter to the diameter of an implant. Okay. The implant is a circle. And so what we do is we match the width of the implant to the width of the patient. The next thing we talk about is implant profile. Profile is how far the implant stands off the chest wall for a given volume. So for example, 300 cc's is not the same across each of these implants. Some look a little bit more like snow globes, some look like pancakes, and there's about, depending upon the company, 5 or so profiles in between. And so what we typically do is after we match the width to the patient, we then determine their ideal aesthetic, what they're looking for. Do you want to does the patient want to be natural, augmented? Do they want to be, a certain type? And so really that kind of guides us to our decision making from there for the profile. So first step, number one, is we match the diameter to the diameter of you. Number two, we then choose the profile based upon your aesthetic. After those two things go into the little implant catalog there, basically if you follow that algorithm, it immediately just leads you to one particular implant there. So when the patient walks in and says, I want to be 400 cc's, well, to me, that's kind of the wrong first step. The first step is to pick the width for you and then go from there. And so anyway, I hope this was helpful. Like I said, if you want more information, we do have a blog on our website that might give you far more details than this. That's kind of the easy 1, 2, 3 implant choosing algorithm there that we use at Lone Star Plastic Surgery. If you'd like to come learn more about this or talk more about that particular surgery, you can schedule a consult with us anytime on our office phone. You can shoot us an email. You can go to our website, LoneStarPlasticSurgery.com, and go in there and fill out a little online request. Anyway, thank you so much for joining us. Dr. Hill at Lone Star Plastic Surgery in Frisco, Texas.